Okay, so I walk into the room and I first wash my hands as I greet my patient. I will introduce myself. I am Shelby, the nurse practitioner. I will be taking care of you today. And then I will assess why the patient is being seen today. So today they're just here for a physical exam, for a work physical. I will then move forward by going over vitals with the patient. And I will also want to recheck my own manual blood pressure. So I would do that at this point. And then from there, I want to assess the patient's orientation. So I will ask them to state their name and date of birth, as well as monitor how they answer questions throughout the interview. And I can also ask the date and place in order to assess orientation as well. And then from that point, I will move on to assess the skin. So I'm just going to look at overall appearance of the skin. So I would start at the head, and I would look at hair distribution, check the scalp for any lacerations or lesions, and then I would move on down the arms, look for hair distribution, temperature, as well as check the legs. And while I'm doing this, visualizing if there's any tattoos or piercings, or any scarring. And then at this point, I would move forward with my cranial nerve exams. So first, I'm going to check the cardinal gazes. So I will ask the patient to follow my finger or my pin light. Excuse me. And then, so I'll have you follow the different gazes. And here I am checking cranial nerves 3, 4, and 6. And then I could then move forward by testing facial expressions for cranial nerves 5 and 7. So I'll ask the patient to puff out their cheeks, smile, raise your eyebrows, and stick out your tongue. Okay, very good. And then from there, I want to do my pupil exam. So I will have the patient remove their glasses. And then with my pen light, I will assess both pupils. Just look straight at me. And make sure that there is appropriate constriction. And then at this point, I will do a fundoscopic exam where I use my ophthalmoscope, and I will check the disc margin of the eye. Just keep looking forward, and I will shine my light, check the disc margins, make sure there's no AV nicking, hemorrhages, any cotton spots, and yeah, so from there, I will move on to check. You can put your glasses back. The ears at this point, so I will grab my otoscope and I will first visualize the external ear, make sure that there's no exudates or edema, and then I will use my otoscope to visualize the inner ear, make sure the tympanic membrane is gray, intact, to make sure there's no erythema or edema. Check the cone of light, make sure that it's at 5 and 7. And then from here I can test the, do the Rhine-Weber test for hearing. So I will ask if they hear vibrations in both ears, if it's equal bilaterally. That's the Weber test. And then in the Rhine test, I just want to make sure that the air conduction is greater than the bone conduction. So I will check bone conduction, have the patient tell me when it stops, and then I will check the air conduction. From there, I'm going to palpate lymph nodes. So I will feel for the pre-auricular, post-auricular, posterior cervical, anterior cervical, the mandibular, and the submental, as well as the supraclavicular. Make sure that I'm unable to palpate any lymph nodes. Then from there, I can visualize in the mouth. So once again with my pen light, I will just have the patient open their mouth and say ah, visualizing that the uvula rises equally, looking at the tonsils, the buccal mucosa, to make sure, make sure that there are no lesions, that the buccal mucosa is pink and moist. Look at the pharynx and make sure that there are no exudates or any lesions there as well. I will also look at the sides of the patient's tongue and make sure there are no lesions or abnormalities there. And from here, I will use my ophthalmoscope to look up the nasal passages, and I'll have the patient tilt their head back, check both nares, make sure that they are patent, that the septum is not deviated, make sure that the mucosa is pink, check for any drainage, and then from here I can palpate sinuses. So I'll palpate the frontal and the maxillary sinuses and make sure that there's no tenderness there. And from there I can move on to my thorax assessment, respiratory assessment. So I will first just visualize symmetry of the chest, check that the AP to transverse ratio is 2 to 1. And then I will go ahead and listen with my stethoscope. Making sure to use skin to skin, stethoscope to skin. And I'll have the patient take deep breaths as I listen in both the anterior and posterior aspects of the lungs. So I will listen in 6 areas. Make sure there are no adventitious sounds. And meanwhile, as I am listening to the lung sounds, I can be assessing the spine to make sure there are no abnormalities there. And then I can percuss the lungs to make sure there are no areas of dullness. And again, I would do that posteriorly as well. And from there, I can do my cardiac assessment, and I will listen to the aortic, pulmonic, tricuspid, and mitral valves using both the bell and diaphragm of my stethoscope. And while I'm here, I can go ahead and assess the abdominal aorta and make sure that there are no bruits. At this point, I will have the patient lay down. And I'm going to assess the precordium, and I'm going to palpate the PMI, make sure there's no thrill and that there's no heaves or lifts. And from here, I'm going to assess the abdomen, first inspecting the abdomen for symmetry, making sure there are no palpable or no visible masses or pulsations. And then I will listen to bowel sounds in all 4 quadrants. As well as the abdominal aorta for bruit. Now I can move forward with percussion. So I will percuss the abdomen for areas of dullness, palpating for masses, and then I will percuss the liver span. And then I would use a ruler to measure the liver span. And then I can come over and try to percuss the spleen to see if there's any dullness there. At this point now, I will start with light palpation. So I'm just going to ask the patient to report any tenderness. If no tenderness is reported, I will continue with deep palpation of the abdomen. Make sure that there are no masses or tenderness noted. I can also palpate for the liver, and I'll ask my patient to take a deep breath and let it out. And palpate for the liver. And do the same for the spleen. At this point, I could assess the kidneys as well. And I should not be able to palpate the kidneys or the spleen. Sorry. Okay, and then I'm just going to look at the lower extremities from this point. Check for any discoloration or edema. And I can also palpate my pedal pulses, as well as the tibial pulses. Okay, and then at this point I'll have the patient sit back up at the edge of the bed. And I can check their reflexes. More to the edge, but I think you're good. And then, so I'm going to check the patellar as well as the Achilles reflexes. So I'll just have the patient relax. You're not relaxed. And check the Achilles. And I would do that on both legs as well. At this point, I could also check capillary refill in the toes. Make sure that that is less than 3 seconds. And then we'll go ahead and assess the lower extremity strength. So from here, I will ask the patient to pull against my hands. Good. And then push out. Very good. Okay. And then we can go ahead and assess the patient's gait. So I can ask the patient to get up and just walk a short ways and come back. And very good. And then I can test their sensory in their feet by using a monofilament. So I will ask the patient to extend their leg, and I will check different points of their feet for sensation using the monofilament, and have the patient report when they feel me touching. I'm going to have you stand back up one more time. We're going to do a couple more tests. I'm going to check your balance. So I'll stand here in case you do get off balance, but I want to have you close your eyes and keep your hands to your side. And this is the Romberg test. I'm just making sure that the patient's balance is intact. Okay, you can open your eyes. And now we are going to test the heel to shin. So I will have you take your right foot and run it down your left shin. Another test for balance, and then do the same. Very good. And you may sit down. And now I can move back up to the upper extremities and again check pulses, radial pulses, and brachial pulses. I can also check capillary refill as I'm here. Like this. Make sure that it is less than 3 seconds on both sides. And then now I can test strength. So I'll have you put your arms like this, pull against me, and push against me. Good. And now I'm going to test the shoulder shrug. So I'll have you raise your shoulders and down. And then with your neck, I'm going to put some resistance on your head, and I want you to turn against. Good. Very good. Okay. And that is testing cranial nerve 11. From here, I will just check the reflexes. And so I'm going to check, just relax your arm, the biceps reflex, as well as just bend your elbow like this, the triceps reflex, and the brachioradialis. And I will do that bilaterally. We are not doing a genital exam today, but I would assess that the scrotum is distended, that there are no masses or hydrocele, no exudates or lesions in that area. And as well as the rectal exam, we'll just make sure that there are no lesions, exudates, or hemorrhoids in that area as well. So from here, that completes my assessment. I would discuss with the patient any abnormal findings or anything of concern, as well as ask the patient if they have any questions for me at this point as well. And then that would conclude our exam for today.